Preparing for a whooping cough outbreak. Identifying whooping cough, or B. pertussis. Whooping cough is a highly contagious respiratory tract infection. Symptoms include runny nose, nasal congestion, red, watery eyes, fever, and cough. These symptoms are similar to a cold or flu, and it can take 7 to 10 days before signs and symptoms can appear. It spreads through bacteria-infected droplets that travel in an infected person's breath, and others become infected by inhaling these droplets when the person coughs or sneezes. There is increased risk for whooping cough for infants under 1 year of age, those who are unvaccinated or haven't received a full series of the vaccine, pregnant women, immunocompromised conditions like cancer, organ transplant recipients, asthma, or other lung problems. They have the highest risk for severe complications. Thick mucus builds up inside the airway and causes an uncontrolled cough. The response team needed will be hospital staff, local and state health departments, CDC, and primary care providers. There will be program managers, medical directors, communication directors, public information officers, local and state pharmacies, and lab technologists from all centers. All of these health professionals will be needed to help track, treat, and control the spread of whooping cough. Whooping cough outbreak will require additional manpower and resources to handle the increased patient volume, extended shifts, as well as these local and state agencies to ensure the antibiotics and vaccines are readily available. The purpose of the response team is to develop mechanisms to ensure identifying whooping cough cases can be assessed effectively and efficiently, support collaboration and communication between those who are involved, ensure staff is educated and understands the proper infection control procedures and the use of PPE, to make sure that lab testing is started, the nasal swabs and blood tests. A spot map and case surveillance will be needed to identify specific geographic areas and time periods to help identify who may become infected, and confirm diagnosis and start treatment. Antibiotics, erythromycin and azithromycin, and vaccines such as the DTaP booster and Tdap can help speed the recovery. Organizational decisions were analyzed, and due to limited staff and resources, it was determined to redirect non-clinical team members so that clinical staff can care for the patients more effectively and efficiently. Inventory management of vaccines and antibiotics will be reviewed to determine the needs of the incoming patients, the patient's family, and staff members to assure supply can meet the demands of the disease. Assessments of patients must be identified before implementation due to staff, vaccine, and antibiotic resource shortages. Strategies and ethical considerations. Implementation strategy along with ethical considerations will be used to determine treatment priority. Healthcare staff and high-risk patients will receive vaccine boosters and antibiotic treatment first. These strategies will help reduce unnecessary hospitalizations and prioritize patient needs. Infants between 1 and 6 months may need to be hospitalized due to the severity of symptoms, which can cause apnea, seizures, dehydration, brain damage, and/or death. Pregnant women between 26 and 37 weeks of pregnancy will need to receive a Tdap booster vaccine, and this can help protect the mother and the fetus and reduce the risk of being infected by whooping cough by 90%. Vaccines, teens and adults will require the booster vaccine of DTaP, And normally the DTaP vaccination is given in 5 doses. The first would be at 2 months, the second at 4 months, the third at 6 months, and the fourth is usually between 15 and 18 months, and the fifth between 4 and 6 years. A booster dose of the Tdap is given between 11 and 12 years of age. It is recommended to get a booster dose every 10 years since the vaccine fades with age. Additional resources that can be used is create a guidance letter for parents during an outbreak explaining the signs and symptoms along with what to do and who to contact. Have policies and procedures created for hospital staff explaining signs and symptoms. A detailed step-by-step protocol for how to treat and who to contact. Both will help reduce the infection from spreading and becoming a full outbreak. In the conclusion, this action plan will guide healthcare professionals for step-by-step instruction, response team, partnered agencies to contact, effective and efficient diagnosis and treatment of whooping cough, all fundamental components of controlling an outbreak. When all parties involved understand their roles and responsibilities, effective, efficient, successful control of an outbreak is maximized. During a time of outbreak, local and state health departments, schools, private physicians' offices, and hospitals should maintain active screening for suspected cases. There will reduce the exposure to pertussis and encourage timely treatment. Thank you.